So I am on hormone therapy. Why am I still not sleeping? You finally did it. You talked to your healthcare provider, your doctor, you studied hormone therapy. Maybe you're wearing the estrogen patch. Maybe you're taking progesterone. Well, you're hopeful. You thought, finally, I'm going to sleep again. But here you are, still awake at 2, 3, or 4 o'clock in the morning. Still exhausted, still wondering, why isn't this working? If this is you, I want to reassure you. Just because you're still not sleeping doesn't necessarily mean hormone therapy isn't helping you. Sleep is influenced by many different things, and hormones are just one piece of the picture, not the entire answer sometimes. So let's talk about it. My name is Milca. I am a nurse practitioner. My office is based out of Columbia, Maryland. I help women in their 40s, 50s, and beyond dealing with the hormonal changes in perimenopause, menopause, and midlife health. One of the most common questions I hear is, I studied hormone therapy, so why am I still awake every night? The answer is more nuanced than most people realize. Sleeping isn't just one thing. We often talk about sleep as though it's one simple problem. It isn't. Sleep has many moving parts: falling asleep, staying asleep, deep sleep, REM, body temperature, stress hormones, pain, bladder symptoms, sleep apnea, restless legs, medications, lifestyle habits. Hormones influence some of these, but they don't explain all of them. That's why improving sleep often requires looking at the whole picture. Let's start with the good news first. Hormone therapy can be incredibly effective for the right woman. If you're waking up because of hot flashes, night sweats, or sudden temperature changes, many women notice meaningful improvements once these symptoms are better controlled. Some women also notice improvements in mood, energy, and overall quality of life. Hormone therapy has changed the lives of many women, and I'm grateful we have it. But here is what I wish every woman understood. Hormone therapy isn't a sleeping pill. It doesn't treat every single cause of insomnia. It doesn't treat sleep apnea. It does not treat restless leg syndrome. It doesn't erase chronic stress overnight. It doesn't undo years of poor sleep habits. It doesn't treat every single anxiety disorder. It does not automatically correct every medical condition that affects sleep. That's why we have to be careful not to expect one prescription to solve every problem. The prescription isn't the end of the evaluation. This is where I think women deserve a better explanation. Starting hormone therapy isn't the end of the evaluation. It's one part of the treatment plan. If a woman comes back to my office and says, well, Milca, I'm still not sleeping, I don't immediately assume the hormones have failed. I start asking more questions. Are the hot flashes improved? Are you sleeping? Are you falling asleep more easily but waking up during night? Are you snoring? Has anyone noticed you stop breathing while you sleep? Have your medications changed? How much caffeine are you drinking? Do you drink alcohol in the evening? What's happening at 3 o'clock in the morning? Is your mind racing? Are you simply awake? Every answer gives me another piece of the puzzle, because the goal isn't simply to prescribe hormone therapy. The goal is to understand why you're not sleeping. Another thing women are not always told is that hormone therapy doesn't work overnight. This is not like taking an antibiotic for an infection or a Motrin for a headache or a toothache. Your brain is adapting. The body is adapting. Hormone receptors are adapting. Sleep patterns often improve gradually, not instantly. For some women, meaningful improvement takes time. It also depends on the whole picture, y'all. the medications you're already taking, other medical conditions, supplements, lifestyle, sleep habits, and yes, sometimes what I jokingly called the entire kitchen sink. Because by the time many women come to see me, they've already tried a little bit of everything. Two women can have the same exact symptom and need completely different treatment plans. One woman's insomnia may be driven primarily by hot flashes. Another woman's sleep may be affected by sleep apnea. Another may have restless legs. And another may have thyroid disease. Another may simply be carrying years of chronic stress. The symptom is the same. The cause isn't. That's why individualized care matters. The treatment should befit the woman, not the other way around. One of the things I hope women take away from this channel is that healthcare isn't about finding one magic prescription. It's about understanding what's happening to your body. Hormone therapy is an important tool. Sometimes it's the exact right tool, but it should never replace thoughtful evaluation, careful listening, and good clinical reasoning, because there's usually more than one piece to the puzzle. If you're on hormone therapy and you're still struggling with sleep, please don't assume you've failed treatment. And don't assume treatment has failed you. Sometimes hormones need more time. Sometimes the dose needs adjusting. Sometimes the answer lies somewhere else entirely. The important thing is to keep asking questions until the pieces begin to fit together. If you found this video helpful, subscribe for more evidence-based information about perimenopause, menopause, and midlife health. And in the next video, we are going to talk about another question I hear all the time. My labs are normal, so why do I still feel awful? I'll see you then.